Hi everybody, I'm Shimira Isitole and I'm the Head of Business Insights and Impact here at GUUD. Now, GUUD is essentially a company that's focused on extending services to people all across the country. Our focus is to make sure that services such as healthcare and general administrative services are able to reach people in even the most remote areas of the country. We focus on making services like healthcare accessible, reliable, verifiable, and ensuring that people are empowered with the information of their healthcare assessments as they take place. So this is our GMAC, the GUUD Mobile Assessment Center, on which our assessments take place all over the country, whether that be in the Western Cape, Limpopo on the mines, and much, much more. The idea is that through mobility, we're able to reach everyone, everywhere, whenever they need it. So at GUUD, we offer quite a lot of healthcare services on the single mobile that we develop. So we offer primary healthcare screenings with a nurse and a telemedicine consultation with a doctor. We offer optometry where they get prescription spectacles immediately after the assessment. And then we also do things like audiology, point of care pathology, and much, much more. Now, these services are offered to general communities, but we also cover more niche groups such as farm workers, school children, mine workers, commercial drivers. The idea is that everyone in the country gets access to these healthcare services that they need. Because unfortunately, the reality is that our public healthcare sector is quite overburdened and is unable to meet the needs of these people. And then the private sector is very inaccessible for financial reasons. So as GUUD, our focus is to make sure that everyone gets access to healthcare and the information they need to empower themselves to live longer and happier lives. So through working on the mobile, you get to be exposed to a multidisciplinary team of medical professionals, whether that be the optometrist, the telemedicine doctor, the nurse, the audiologist, and much, much more. So in this experience, you get real life experience with the communities and the individuals who need help. So you get to engage with the students who are realizing for the first time that they've never been able to see. You get to see the real impact of the medical interventions that we offer on these mobiles. This is something that's so unique because South Africa's healthcare system is in a quite challenged state. And so you get to see the direct impact of services that people have never been able to access before. It's not something that is just limited to theory. This is practical experience with professionals who are willing to help you learn and to understand the real difference that you can make by being in the healthcare space. So on the mobile, a lot of the patients who we see have no idea what their health state is at the moment. So whether that be mine workers who spend hours underground exposed to extreme heat environments, these individuals have high blood pressure, high blood glucose from the meals that they're constantly engaging with to stay active in those spaces. And the concern is that they aren't made aware of these health concerns until it's too late. But through this intervention, they're given that information far earlier or long in advance before things are at a state where they can't be helped any further. With school kids, we also see that the optometry is a major, major game changer for them because eyes allow them access to their education. So them getting the prescription spectacles gives them that access to the information that they're trying to have, and that is going to allow them to grow and be contributors to their families and their societies one day.